what to expect after hair transplant and how it will be your look month by month, let us discuss on that part. So what happens immediately after hair transplant? Immediately after hair transplant, doctor will put a bandage on the frontal part or forehead area so that the swelling doesn't migrate on the eye, as well as they'll put a dressing on the donor area so that the grafts, the open area from where the grafts are extracted, is properly covered. They will usually tell you to do the dressing in the donor area, whether it's a beard or it's a scalp. They'll ask you to do dressing on that area, and then post that you have to just apply the antibiotic cream. As regards to the frontal area, so what your doctor will tell you is to spray some solutions and some normal saline solution you have to spray for 7 days every hour, and to be in a comfortable place. You have to be inside home. You don't have to travel much, only travel when it is required. On the 7th day, they will call you for your head wash. In this 7 days, you will be taking all the medications, which include your painkiller, antibiotic, all these things. So the grafts initially, when fresh, they were looking skin colored or bluish. If they have used a dye, they will slowly turn into blackish crusts. On the 7th day, you will experience there is some crusting, there is some oozing, and the grafts tend to become dry. So the whole area gets dry. So it will look like black dots which is dried out. And this is the time on 7th day you go to them for a head wash, or if you have traveled for hair transplant, they will teach you how to wash your hair with the baby shampoo. So most of the crusts will come out, but you don't have to pull at the crusts and all. Let them come out on their own over a few days. So in the next 10 to 15 days, whatever are the remaining crusts, they are going to come off when you wash your hair gradually. So this is how in the initial 7 days to 10 days it's going to be there. And then small hair is going to sprout out, and the shedding phase will be initial first 2 to 3 months will be the shedding phase, in which your hair is going to pop out and it's going to fall. The same root is going to produce hair again after 3 months, but not every hair is in the same cycle. They are in different phases, different growth cycles, so it will be a very patchy kind of an appearance for first 3 months. After 3 months, your growth phase starts, the hair starts growing, and according to your length of the growth phase and all, they will start growing and blending with your original hair. Now the original hair which is remaining on the scalp is little softer. This hair which is growing might feel a little hard. So to make them soft, your doctor might give you certain serums and all that you can use, and medications also for hair growth. You will be given PRP sessions every month for the first 3 months or 4 months, which is not mandatory, but if you are taking PRP or GFC sessions, it will help your existing hairs as well as your implanted hairs to grow in a better position. So you will be taking all those supplements. You will be starting your finasteride if it is given to you, your minoxidil, all those things are going on, and this is how each month the hair will progress. So this is a picture of 7th day how it is looking, then this is of 15th day how it's looking, this is 1 month, this is 3rd month, 5th month, and by 6th month to 8 months. 6 to 8 months is a period where your look is changed, the hair is grown, and it takes total of 1 year sometimes for your hair to grow back. So you have to be patient. There is shedding also happening, there is growth also happening, and you getting used to the look of it will take around 6 to 8 months time. What happens is your baldness also starts to progress. So in that case, you have to make a choice that whether you want to continue with the medications. All those things you have to discuss in depth with your dermatologist or your hair transplant surgeon.